Hi, everyone, and welcome to CE Institute. My name is Selena Belisle, and I am the founder and one of the board-approved CE instructors where we teach trigger point therapy. We primarily teach to licensed massage therapists, cosmetologists, and nurses in the state of Florida. We're approved with those three state boards, as well as board-approved by NCTIMBA, the National Certification Board for Therapeutic Massage and Bodywork. So we have a lot of licensed massage therapists nationwide taking training with us to earn their CE credit to maintain their memberships and renew their licenses. Now we teach to other licensed healthcare professionals beyond these trades. However, the theme here is that you should be a licensed healthcare professional to apply soft tissue application. This trigger point therapy is part of healthcare application, and you must be licensed to practice it. This is a continuing education school where we're teaching usually to graduates who are building on their rudimentary education. You need to be able to rule out precautions, contraindications, and more before you start touching and working on clients. What I'm going to share with you right now is a very small excerpt of one of our training units in the home study program for trigger point therapy education. Right now, I'm going to share what our school definition of a trigger point is and how we relieve these. I'm not going to show any instructor demonstrations of trigger point therapy. We'll leave that for you to follow up with and hopefully purchase one of our trigger point therapy hands-on home study, live webinar, or in-person classes. But if you'd like to learn a little bit more about what a trigger point is and how we teach to relieve trigger points, here's your explanation. Manual trigger point therapy application was developed through practicing the client's feedback and in numerous case studies, okay? Trigger point therapy wasn't developed in a lab. Like pharmaceuticals often are and stuff like that, right? It was real time, real client practice. Trigger points are very real, okay? Especially, I'm a retired athlete. I've won 3 WAF world titles as an arm wrestler. I won my first world title in the Athens Olympic Stadium in Athens, Greece. And to get there as #1 on Team USA, I went through rigorous training. And rigorous training, overuse injuries. I had a lot of trigger points in my body. Let me tell you, they're real. Doctors in the medical community have sometimes dismissed the reality of trigger points. They like to pretend that it's not there. It's kind of like the wind. Oh, you can't see the wind. Maybe you can't see the air moving itself. You can see the result, which is the trees rustling, right? Well, that's what we have. You can't necessarily see the trigger point through the skin. You might not even be able to palpate it. It doesn't necessarily always feel like a nodule, which some people teach, and that's not accurate. Trigger points are not always palpable. Sometimes you're going to feel a contraction or spasm where a trigger point is, but oftentimes you will not. Okay, just because you can't see a trigger point doesn't mean it's not real. Just because you can't feel a trigger point doesn't make it not real. There are some tactile imagers and so forth that show hot spots where trigger points are, but those have been validated, they've been dismissed. It doesn't really matter. The fact of the matter is trigger points do exist. It was a theory developed by 2 brilliant physicians. One was a physician to the president, John F. Kennedy, due to his back pain. And trigger points are a reality that we must live with and find ways to treat to relieve pain. Dr. Simon's co-authored Dr. Travell's text and a lot of her trigger point therapy educational material. And I have this quote from him that I think is extremely valuable and something you should remember when applying your hands-on techniques. Also, in helping explain to your clients why no one else is doing this for them, why their physician hasn't recommended this, or why their physician didn't do it. There's a reason why. Let me tell you Dr. Simon's quote. He wrote, "Muscle is an orphan organ. No medical specialty claims it. As a consequence, no medical specialty is concerned with promoting funded research into the muscular causes of pain, and medical students and physical therapists rarely receive adequate primary training in how to recognize and treat myofascial trigger points." Trigger point therapy is about working with muscle and myofascia. Okay, we're pressing on fascia and musculature, soft tissues of the body, to relieve trigger points. We don't want to press directly on nerves, organs, bones, blood vessels. Okay, those can also create unreasonable, irritable amounts of pain. You want to make sure that you're on the soft tissue structures of the body when seeking and trying to relieve trigger points. We're working with the muscle and the myofascia that encases the muscle. It doesn't matter if the trigger point's in either. You're probably not going to be able to tell the difference with simple palpation. But what you are going to do is, once you find a trigger point in the soft tissue, whether it's fascia or muscular or both, you're going to apply pressure to it, hold it, and wait for that excess irritability to dissipate. Usually when you're on a trigger point and you apply sustained pressure to it, that excess irritability will dissipate and become less and less and less. And believe it or not, that pain can be relieved through simple sustained pressure and trigger point therapy. Now, I've already reviewed a couple different ways the American Academy of Family Physicians tells you how trigger points can be relieved, which is including manual manipulation, right? Let me give you the whole list of what's being practiced today, in addition to what I've already reviewed and the claims that most professionals say these are effective, especially if they're practicing them. Keep in mind, massage therapists may not be within their scope of practice to apply some of these techniques, but these are all the different ways trigger points are being treated. Keep in mind, somebody might say, "Oh, I've had trigger point therapy already." They might have had dry needling or drugs. Okay, so make sure when somebody says, "I've had trigger point therapy," you're very specific and ask them, "What type of trigger point therapy did you have?" These are the ways trigger point therapy is being practiced or claimed to be practiced. First is the ischemic compression that we're going to apply here in this class. We're going to apply pressure directly into a trigger point in an attempt to dissipate any pain that they're feeling with a trigger point. There's spray and stretch technique, which we already reviewed. There's also something called dry needling for those who have a scope of practice to insert needles into their clients. They might put a needle into the trigger point and just leave it there stationary. They also might manually manipulate a needle on a trigger point as well. There's ultrasound and stim. There's also muscle energy techniques, laser therapy. Of course, we discussed the injections. The injections are usually with saline. Pharmaceuticals and mechanical vibration. All of these are used to try and relieve trigger points. We feel that true trigger point therapy is only the ischemic compression. It's only that pressure that's applied to a trigger point manually is what should be called trigger point therapy. But just know, if you have clients calling you, they're in pain, you suggest, "Oh, I do trigger point therapy," they might suggest they already had it. They could have a wide range of modalities that did not include the manual therapy that you're going to learn and practice. We don't think ultrasound and dry needling and spray and stretch and stim is true trigger point therapy. Unfortunately, some people are claiming it is. As your instructor, I want to reiterate as well that I think things like saline injections and cold spray can actually irritate trigger points or cause more trigger points. That's why I feel true trigger point therapy is only the manual application of sustained pressure into a trigger point. So different practitioners and clients are going to have different ideas of what trigger point therapy is. In this class, our definition of trigger point and trigger point therapy is they are hyperirritable spots on the body that can be relieved through manual application of sustained pressure. That is a trigger point and our trigger point therapy application. Some practitioners, when they're doing manual trigger point therapy with their hands and elbows and so forth, they might start manipulating around on the trigger point. They might try and vibrate and jiggle their elbow or their knuckles around and so forth. And I have to tell you, maybe 1 or 2% of the time, that might be appropriate and effective, okay? But most of the time, and I mean almost all of the time, it's sustained pressure that allows that trigger point to dissipate. Most of the time, when you move on that hyperirritable spot, it just fires up more pain. So the last thing you want to do is move and do anything vigorous or moving on a trigger point. Sustained pressure usually allows that trigger point to disengage and start dissipating and relieving itself. Also, trigger point therapy does not have to be used in conjunction with other therapies to be effective. In my hands-on application that I'm going to practice with a live model, you're going to see me occasionally warming up an area, and you'll see me, I call it making nice afterwards. And I think that's an appropriate trigger point therapy application. I do not sell trigger point appointments by themselves. You can if you wish. That's your choice. But most of the time, trigger point is part of a bigger appointment like deep tissue massage and other body works. It's sustained pressure and communication. Using an intensity scale is vital to your trigger point therapy application. So you're going to apply pressure to an area and then ask them what their number is on the intensity scale. We'll teach you that later. Trigger point therapy is effective on its own. You don't need to make nice or warm up with the tissue, but we do think it's a better application when you do. Skin rolling over the area, warming up the superficial fascia and superficial myofascia. All of that will probably make the best, most effective trigger point therapy application for your client. So that's a brief excerpt of our trigger point therapy training that is available in our home study program at CE Institute. So if you want to see more of that training, including the hands-on application of treating trigger points, you can purchase our trigger point therapy home study course, which will be available to you 24 hours a day, 7 days a week, on our website until our course access expires with your purchase. You can view that and register at ceinstitute.com to see the full training. So we hope you found that helpful in learning about what the real definition of a trigger point is according to our school and how we treat it. Watching the hands-on application is effective because we show you referral patterns and explain where the client might be feeling your pressure, and it's not necessarily always where you're pressing. It's a little bit more complicated than just pressing on a trigger point. We want to learn referral patterns. This helps us establish where we might work next, and many other things that are shared in a longer and more formal training. So we would love to see you in another class, and until we do, be safe.